Hey everyone, welcome back to Course 7 Nursing. My name is Wilker Patrick. I'm a nursing educator inside the Course 7 Nursing platform. And today we're going to go over burns. Everything you need to know about burns. So burns types, management, severities, and of course the rule of nines. So let's get right into it. Before we jump straight in, know that we do have concept maps available that are free to download on our website, course7nursing.com. Or if you wanted to get our integumentary flashcards that includes all the content we're about to go over, make sure you guys look at the Course 7 Nursing membership. All right, let's get straight into it. All right, the first thing we're going to get into is the burn depths and the burn types. But to quickly define what a burn injury is, it's skin damage that is a result of a energy source. Well, of course, this energy source is related to burns, but that actually brings me to my first point. There are different types of burn injuries. So we're going to go over the types of burns here first. So the first type is thermal. So the burns that we all think of, such as fire, hot liquids, or of course hot objects such as a frying pan. These typically cause superficial burns, and we're going to get into more details about the depths here in a second. The next one is chemicals, so things such as gasoline or bleach, something that is a corrosive substance that is either acidic or alkaline. Another type of burn that we commonly think of is radiation, so such as sunburn. Other types of burns in this category could be medical radiation for cancer treatment as well. And then there is friction burns, so things such as road rash. So if you wreck off of your motorcycle, for example, you could have a friction burn injury. And then lastly, there is electrical burns. Now these ones can be pretty severe because they could be systemic, so it could cause some kidney damage or myoglobin that blocks those kidneys from functioning properly. We'll get into more detail about that later. But those are your types of burns. Now we're going to get into the depths of burn injuries. So there's 4 different degrees. So first degree is called superficial thickness. By the way, guys, make sure you guys write these down, as this is a common NCLEX topic. And of course, in your nursing exams, if you're in nursing school, you're going to have questions about knowing the differences between these burn depths. But like I said, first degree is superficial thickness. So think of nothing that penetrates the skin. It's just surface level things, such as sunburn, so radiation type burn injury. So this just involves the epidermis, so the very top layer of your skin, and it doesn't travel down to the dermis. So common signs and symptoms, once again, think of sunburn, so that tingling, or the hyperesthesia, so hypersensitive to touch, and of course peeling, and then lastly itching. So once again, first degree, superficial thickness, think sunburn, it only involves the epidermis, the very top layer of your skin. And then there is second degree, so it's superficial partial thickness. So what that means is the epidermis, but also partially the dermis. So think of injuries like scalds, so hot liquids or hot objects, or flash flames, so something that is enough like a simple burn that causes damage to that epidermis and partially that dermis. So the signs and symptoms you'll commonly see here, of course, is pain. Once again, the hyperesthesia, so sensation is so sensitive to touch. Blistering is a common sign and symptom. So think if you've ever had a burn on your arm, for example, or your hand, there's blisters. So that is like your superficial partial thickness injury, so your second degree. Next is third degree, so that is deep partial thickness. The layers of skin involved is epidermis, the dermis, and partial adipose tissue. Common burn injury types is flames, electrical, and chemical. Now a key thing to remember with this is the first degree where things are insensitive. So things are not as sensitive as the first or second degree. Second degree would say be the most sensitive, where they can actually feel it with air currents. But third degree, you're not really going to have much sensation left because it actually went through that dermis where most of the nerves are stored, and it's now in your adipose tissue. You can also expect to see pale white skin with slaw or eschar involved. Then lastly, there is fourth degree, so that is a full thickness burn injury. This involves epidermis, dermis, adipose tissue, but also the deep muscle or bone. With this, you'll have no pain, and a lot of the times, the area looks charred. All right, so next we're going to get into the rule of nines, since that pertains to the assessment of a burn injury. So we just went over the depth, we went over the burn injury types. Now let's continue on and finish the assessment section by going over the rule of nines. And then after that, we're going to go over the complications of burns, and of course the immediate management and the management of it afterwards. And then we can finish it up by going over our nursing interventions. So the rule of nines, this is a common concept in nursing exams. You're going to have it. And of course, you're probably going to see it in the NCLEX as well. So make sure you guys write this down and truly understand it. Understanding the rule of nines actually is a pretty simple task. It's just simply remembering what percentage goes with what body extremity or what area of the body. But really what makes it more difficult is you understanding how to do the Parkland formula. So how to actually do the fluid resuscitation calculation from your rule of nines. So that's something you guys want to tie in together, and we're going to go over that today too and do some samples. So as you see in this chart, we are divided by anterior and posterior, and you're going to see percentages on both of these avatars here. Each side is segmented by head, torso, arms, and legs. With the exception of the front, of course, 1% of that goes to the groin area. Now, like I said, write these percentages down and really understand. Do it the best way that makes sense to you when you write your notes down. Maybe it is this chart, and take a picture of it. But just to really in short, without doing every single body part and going over every percentage, if we really segment it out, we're going to remember that the head is 9% total, so 4.5% in the front, and then 4.5% on the back. And then the arms are also 9% total, and then the torso is 36% total, and the legs are 18% total. So think there are 2 arms, so 9 and 9, and then legs is 18 and 18, and then the whole torso is 36%. And what this rule of nines actually is doing is measuring the total body surface area, which is involved in the fluid resuscitation formula that you need to input a calculation in order to get that right number. So the formula you need to remember is 4 mLs times the body weight in kgs, then times the total body surface area that you calculated from your rule of nines. So a typical problem is going to give you those 2 measurements. It's going to give you the patient's body weight in kgs, or maybe it does give you a body weight in pounds, so make sure you convert it that way. If you don't know how to convert, make sure you guys go to our dosage calculation nursing course. That will show you how to do that. And then of course is the total body surface area, so the percentage total of the burn that it's located at. So it's going to give you multiple locations of burns where this patient had it, and just make sure you go through your understanding of this chart and put in the number there and then multiply it all together, and that will give you the amount of fluid resuscitation this patient needs to properly treat them. But an important thing to remember, a lot of the problems will ask you, well, what is the amount of fluid they need in the first 8 hours, for example? That's because an important note to write down is that with the first 8 hours, 1/2 of those total mLs that you calculated will need to be given. After that 8 hours is over, the second half of those total mLs that you've calculated are given over the next 16 hours. So total of 24 hours of this infusion. So let's say that you calculate that there's 1,000 mLs that you need to give your patient. So that first 8 hours, you need to give 500 mLs. And then after that, you slow the rate down and then give the rest of the 500 mLs over the next 16 hours. So to wrap up the rule of nines, let's go over a practice problem calculating the total fluid amount we need to give a patient. So what this problem reads is a patient with burns over 18% of their total body surface area requires fluid resuscitation using the Parkland formula. If the patient's weight is 70 kgs, how many milliliters of lactated Ringer's solution should be administered in the first 8 hours? So as I mentioned there, they're going to put all these words in here. They're going to give you the patient's body weight. They're going to give you, in this case, they did give you the percentage, so that's nice. Because a lot of times they'll say they have a burn on their head or a burn on their arm. You have to calculate it yourself. This one gives it to you. And then, of course, it's asking you in the first 8 hours. So make sure you really pay attention to that last piece there. So if we were to do this problem together, so we would start with the Parkland formula, which is the fluid resuscitation formula. We would do 4 mLs times 70 kgs, because that's the body weight, then times 18%. So then we would just put the whole number here as 18. So then you would get the total amount of 5,040 mLs. Now remember that last piece there is asking you, how much should you infuse in the first 8 hours? So if we remember that note that we took down earlier, that the first half of those total mLs needs to be given in the first 8 hours. So then we would divide that 5,040 by 2, and then we have our number here. The correct answer is 2,520 mLs. So that was just a quick little practice problem. Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. All right, so we're about to get right into the management of burn injuries. But before we do that, us as nurses need to understand the pathophysiology. So if a patient does have a severe burn injury, what kind of things should we be looking out with different types of systems involved? So what we're going to do is show this chart here. These are the 4 systems we need to look after when a patient has a burn injury. We need to look at the cardiopulmonary, renal system, gastrointestinal system, and of course the fluids and electrolytes. What are the risk factors associated with a burn injury with each one of these systems? So with cardiopulmonary, we're concerned about hypovolemia. So you could probably assume that if we have a fluid resuscitation formula to learn about burn injuries, you could probably assume that part of that treatment is fluid resuscitation, right? Because the concern is when you burn, when you have a severe burn, it dehydrates the body. It's taking a lot of water substance out of our body. And of course, we need to replace that to prevent cardiopulmonary issues. So that big concern is hypovolemia. So think of it no different from a common sign and symptoms with hypovolemia. You're going to see a higher heart rate, a lower blood pressure. And with that, you're going to have a decreased cardiac output. So it's going to cause damage to those organs that, of course, need continuous blood supply and oxygen. Now, a compensatory mechanism that our bodies will most likely do is try to cause vasoconstriction, which is usually triggered by beta agonists. But those beta agonists, when they cause vasoconstriction, they can also cause bronchoconstriction. And with that bronchoconstriction, it can cause hypoxia. So that would be with your involved cardiopulmonary systems. Now let's move on to renal, as this is a common concept that the NCLEX or your nursing exams will question about. Since there is vasoconstriction and hypovolemia, your kidneys are not getting enough blood supply or oxygen to them. And as we may have known before, we talked about this in our other courses, is that the kidneys are the neediest organ in the body. They take about 20% of your cardiac output. So they're one of the first organs to recognize if there's something going on with your circulation, and they have all those compensatory mechanisms that we just mentioned to prevent the body from going into a complete shock. So if we have a decreased blood supply to those kidneys, it's going to cause vasoconstriction because that's the compensatory mechanism. It's going to vasoconstrict, so that way it will help the blood propel to the kidneys in a further distance because of that decreased cardiac output they're sensing. But eventually, if it's not treated properly, the blood supply is still not efficient enough because there's not enough volume. So what you could expect is a decreased urine output. That is something you must write down. That is a common concept they'll ask about is if you have a patient with a severe burn injury, make sure you know that one of those complications is a decreased urine output. And also too, myoglobinuria is possible. Why? Well, especially with those deep tissue injuries from a burn, well, it of course releases myoglobin into the bloodstream, and those myoglobins are very damaging to those kidneys. It could get blocked up, and of course it can cause things such as rhabdomyolysis, and overall could cause acute kidney injuries or kidney failure. And hypovolemia also causes problems with the gastrointestinal system. So think dehydration, constipation, so you have decreased peristalsis as well. So with that, you're at risk for a paralytic ileus. So make sure you guys write that down as a common complication. And then lastly is the fluid and electrolytes. Now this is usually the root cause of all the other issues that we just mentioned, because when you get a burn injury, it increases the capillary permeability. So think our veins hold in fluid, right? But when they have a burn injury like that, they're more likely to allow fluid to leak out of that vascular system. So that's typically what we find as like pitting edema, for example. Well, if we have so much fluid leak out of that vascular system, it's going to leave our vascular system hypovolemic, which we just talked about, all those systems that get impacted from that. So with a burn injury, expect increased edema, hyperkalemia, hyponatremia, and then metabolic acidosis. So hyperkalemia, a high potassium, hyponatremia, a low sodium, and metabolic acidosis. So a low pH that's caused by low bicarbonate levels from the kidney. So you may be asking, why does hyperkalemia happen after a burn injury? Well, when we have a burn injury, it damages a lot of cells, especially with a severe burn injury like this, where it would cause fluid and electrolytes issues in the first place. Now, if we're talking first or second degree or even third degree, it's not likely that we have this issue unless it covers a large surface area of the body. This is where we start having these issues. Now, so if it's a big, severe burn injury, you could possibly have hyperkalemia because potassium likes to sit in that cell. And once they realize that the body's acidic, because usually the kidney reacts and it gets acidic in the bloodstream, potassium leaves the cell to go into the bloodstream, and of course that will cause hyperkalemia because it's trying to swap with hydrogen ions in that bloodstream, so that way it lowers the acidic piece of the blood. We have more detailed courses about this, especially the RAS system course. I suggest you watch that if you want to learn more about the potassium relationship with acidic blood. All right, so let's go over management. So we're about to get into those phases of management with a burn injury, but before that, let's interrupt it with going over what is the immediate intervention. So if you're a nurse in the field, for example, and they will ask you questions about this, what are the immediate treatments to a burn injury? So first of all, you have to evaluate the scene to make sure it's safe. That's typically the first intervention they'll ask about. So you want to evaluate, and if it's a fire, you want to extinguish it, and then remove the patient and yourself away from the fire. And then the next actions you'll do is first cool the burn, but no ice. That's a common thing they'll try to trick you with. So no ice on it, but you can soak the burn with cool water. And then remove restrictive objects or clothing. We're going to get into why that is, but just on the surface level of things, it's because of the risk of compartment syndrome. Then if it's an open burn, you want to go ahead and cover the wound with a clean, dry dressing. And if it's a chemical burn, you want to irrigate that burn. All right, now that we talked about the immediate actions you take when you see a burn injury, now let's go over the phases of burn injury care. So the first phase is the emergent/resuscitative phase. Now that word resuscitative, you can probably remember that we talked about fluid resuscitation. So a big piece of that emergent/resuscitative phase of a burn injury is giving them fluid resuscitation. So when we talk about the emergent/resuscitative phase, it goes on from the onset of the burn until the completion of fluid resuscitation. So this typically is the first 24 to 48 hours after the burn injury. Now think this is an emergency, so think your ABCs. So airway, breathing, and circulation. So we're of course going to first address the airway. So make sure if they did have a burn, it's not compromising the airway. So of course evaluate the airway, check their breathing, and of course, the next thing is that with the fluid resuscitation, we're taking care of the circulation here. Why would we take care of the fluid resuscitation? Because they're at risk for hypovolemic shock once again. So this is where we would determine the total body surface area, do the Parkman formula, and start fluids immediately. So that first half of those fluid total would be in the first 8 hours, and then the second half would be over the next 16 hours, so a 24-hour infusion total. What we're going to do as nurses, we're going to insert large bore IVs. Those are common keywords that they use on the NCLEX and the nursing exam. And common fluid types that they will use is lactated ringers because it has some of those electrolyte components to it, and of course crystalloids as well. Now, one of the priority things you want to monitor for is the renal function. And something you'll want to remember is the urine output expectation. We want the urine output to stay above 30 mLs per hour. Once it gets below 30 mLs per hour, they're at risk or there are already signs of an acute kidney injury. So a common intervention that we'll do just to monitor really closely is inserting a Foley catheter so we can get an hourly urine output. And then the next phase is the acute/intermediate phase. This is defined by when the fluid resuscitation is complete and the capillary permeability is restored so that fluid won't be leaking outside the vascular system anymore, and wound closure is begun. So this is typically 48 to 72 hours after the burn injury. So the priorities with management in this phase is of course preventing infection. So typically we're going to give them IV antibiotics because skin is your first layer of your immune system technically. So you want to go ahead and give them IV antibiotics because they're at risk for infection. Nutritional support, so giving them more protein and just calories in general. So we want to get them enough calories to heal properly. And then wound closure, this of course is specific to each case depending on where the injury was located, but the overall goal here is to start treating the wound. If it was a severe burn injury, that can involve debridement or grafting. One thing that you will need to write down in this phase particularly, and they'll question about this, is the complication of hypokalemia. Now, why would hypokalemia happen when we just said that when there's a burn injury, there's hyperkalemia, there's high potassium? Well, when we start resuscitating fluids back into the patient so the fluid volume increases, expands in that vascular system again, it decreases the acidosis, it decreases the permeability of the vascular system space. So then what happens is potassium will go back into the cell. That's where its home is. So once things are comfortable in that vascular space, potassium will go back into the cell, and what that does is it depletes the vascular system space of potassium. So you want to look out for hypokalemia, and sometimes we do have to replace it with potassium supplementation. Other complications that we mentioned earlier that happen particularly in this phase is paralytic ileus and then peptic ulcers. And then lastly, there is the rehab phase. So the goal with this is to close the wound up, of course, prevent any tears going on and get physical rehab done. Now we talked about everything you'll need to know except for some of those specific complications that they may ask about. One of those is compartment syndrome. Now, especially if it was a distal extremity, such as your foot or your leg, it is possible that it could cause compartment syndrome and decrease the circulation below that point. And what happens is eschar forms and compresses the vascular system within it. And that pressure builds up in a compartment. So circulation can't really get past that compartment. End result, it's blocking circulation to go through it. And of course, the distal part below that site of that traumatic burn injury is not getting enough circulation, and that could cause an overall tissue injury. So you're depleting that area with oxygen and blood supply, so that could cause tissue death of that area. So the management of this is possibly an escharotomy, which is an incision through that S card to release that compartment and make sure that circulation can continue to go down below that site. With compartment syndrome, make sure you understand these 6 P's. Those 6 P's is pain that cannot be fixed with medication typically. So if you give them pain medication, that's not going to fix the pain because the pain is actually coming from the ischemia of that extremity. Then there's pulselessness. So for example, if you have a burn injury on the upper leg and you have no pulses on that DP pulse or the foot area, then you can expect this could be compartment syndrome. Then there's paresthesia, so tingling, numbness of the area. Poikilothermia, which is coolness of the area. Pallor, so of course paleness. So if you're not getting enough blood supply to the area, it's going to get pale. And then eventually paralysis. So once the blood supply has been deficient for so long, the nerves will be unable to function properly. So just like how you have a dead arm when you wake up in the middle of the night, this is the same kind of concept because there's not any blood supply going to those nerves to communicate to the body. And then the other specific complication related to burn injuries is possibly carbon monoxide. So with this, someone could have hypoxia without actually having a low oxygen saturation. So a common sign and symptom is cherry red skin. Make sure you guys write that down. And with the lungs, they could have stridor. So that audible stridor that sounds absolutely terrible. It's the closure of the upper airway. And they could have black tinged sputum because this is common with burn injuries where they're in of course, an enclosed space where smoke is building up, where they could have that all building up into their lungs and cause carbon monoxide poisoning. So with that, they're going to have airway edema, and that could cause even further closure of the airway. So that is why you probably are going to hear some stridor. So the immediate management of this is 100% oxygen mask. Put them in high Fowler's position to improve that ventilation. And of course, closely monitor that airway to see if they do need an intubation. And any level of above 10 with carbon monoxide is considered poisoning. All right, guys, that covers everything what you'll need to know about burn injuries for your NCLEX or your nursing exams. I hope this was helpful. Thank you guys so much for watching, and we'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching, and we'll see you in the next video.